Hi, I'm Dr. James Meschino. What are erectile dysfunction drugs? How do they work, and are there any health risks? Well, by now most people have heard of drugs like Viagra, Cialis, Levitra. These drugs are used to treat erectile dysfunction. So, how do they work? Are they safe? Are there side effects associated? And are there any natural alternatives that people could use if they wanted to know about that? Well, erectile dysfunction is defined as a consistent inability to obtain or maintain an erection for satisfactory sexual relations. And some people have complete erectile dysfunction, where it's an inability to have any penetrative relations at any stage. So that's more like complete impotence, if you will. How common is the problem? Well, by age 50, about 50% of men have some degree of erectile dysfunction. Maybe not complete erectile dysfunction, but they have some degree of it. By age 60, about 75% of men have some degree of erectile dysfunction. So it's a pretty common problem. There's lots of reasons for it. The aging process is part of it. Clogging up your blood vessels can be a factor. Alcohol, diabetes. There's a number of factors, psychosocial factors. And that's why these drugs have become so popular. So the medical treatments have been things like Viagra, Cialis, Levitra. And what they do, the way they work, is that in order to have an erection, in the blood vessel wall, it has to make a little chemical called cyclic GMP. And normally cyclic GMP gets broken down, but those drugs actually stop the breakdown of cyclic GMP. They inhibit the enzyme that would break it down, so you sustain the cyclic GMP levels for a longer period of time. And that allows more blood to stay in the blood vessels that feed into the genitalia, and that's what gives an erection and keeps the erection firm for a certain length of time. So these drugs have been shown to work. The problem is that they don't just work in the area of the genitalia, but they tend to have an inadvertent effect throughout the whole circulation of the body. So other blood vessels now dilate, or they stay open for longer periods than might be appropriate. And that sort of can drop your blood pressure very quickly. Well, when that happens, the heart starts to respond, and it can start to go in what's called atrial fibrillation or flutter, and it can lead to cardiovascular complications on some rare occasions, but it has happened. And because it has happened a number of times, Cedars-Sinai Hospital in Los Angeles, California, decided to do a study of people who have used Viagra and associated adverse events, particularly cardiovascular events. So they looked at over 1,400 different case reports, and they published their information in the Journal of the American College of Cardiology in February of 2000. So these researchers from Cedars-Sinai Hospital analyzed what's called post-marketing adverse events reported to the Food and Drug Administration between April 14, 1998 and May 21st, 1999. They looked at 1,473 serious adverse events that were sort of related to the use of Viagra specifically. And some of these events included sudden death, heart attack, heart arrhythmias, congestive heart failure, strokes, sudden drop in blood pressure, as well as fainting. The key findings were these. The majority of deaths were due to cardiovascular events, and mostly occurring in patients, and this is what's surprising, who were under the age of 65. The average age was 61. And the majority, about 67%, who had no previous history of heart disease or any vascular complications. So the majority of these cases occurred in men that had no previous history of vascular disease. 70% of deaths were associated with the 50 milligram dose of Viagra, and 2/3 of the deaths occurred within 45 hours after taking the drug. And most deaths occurred in men who were not taking other nitrite drugs or nitrate drugs. So drugs like nitroglycerin. We've known for a long time that it wouldn't be a good idea to combine nitroglycerin with a drug like Viagra. But most of the events occurred in men who weren't taking those drugs. So the initial warning that patients taking nitrates and Viagra at the same time had an increased risk of adverse cardiovascular events has not been the only problem with Viagra, since only 12% of deaths occurred in men who were taking nitrates. So some of the medical doctors that I know personally are actually reluctant to recommend these drugs, like Viagra, to their patients, or even use them themselves. And there's other side effects associated with these drugs. The most common ones are headache, facial flushing, upset stomach. Some less common ones like temporary bluish vision and some other sensitivity to light problems, loss of vision, loss of hearing, these things occur, a little more rarely. Only Viagra causes division or problems, whereas Cialis in about 5% of men will cause muscle aches. And Viagra and Levitra last about 4 hours in your system. Cialis actually stays in the bloodstream for 17 and a half hours as in terms of the half-life. So with Cialis, you have a longer window of opportunity for sexual activity. If Viagra is taken with a high-fat meal, it decreases the absorption. But the plasma concentration actually reaches its maximum after about 1 hour of taking Viagra or Levitra, and the total effect can last about 4 hours. So my point is that there's some concerns about using Viagra, Cialis, and these Levitra-type drugs because of the effects on the cardiovascular system. So some doctors don't use them themselves and don't recommend them. The other possible treatment medically is testosterone replacement therapy. My concern with that is that if you have any cancer in your prostate, even if it's just a few cells and then the cancer is not really bothering you or may never bother you, putting testosterone on those cells, the potential is that it can cut those cells and start dividing and you end up with full-blown prostate cancer. So a lot of doctors, including myself, have concerns about using testosterone replacement. What I'd like you to know is that there's some natural herbal remedies that are totally underappreciated, and the right combination of natural agents has been shown to work really well. Their synergistic effects have been proven to increase blood flow to the genitalia, so you get a better erection, improve sensitivity of the genitalia, so there's easier arousal, and also increase libido and desire. Some of these natural herbs have even helped women overcome low libido problems and help them reach climax more easily. The flip side of that is that there's some dangerous supplements that sometimes are included in these formulations to improve erectile dysfunction, and some of the supplements themselves are actually quite dangerous, can lead to bleeding disorders and some other problems. So what I'd like you to understand is, how to use some natural things in a way that's safe, if that's the route that you want to go. So I've created an ebook that's available right here. It's called Effective Natural Remedies for Sexual Performance and Libido, a guide for men and women. You really should download it now. If erectile dysfunction or low libido problems are affecting your quality of life in any way, you should download that ebook right now. Now remember, at Meschinohealth.com, you'll see my other research review papers, you'll see other videos, footage from my live seminars, other downloads and resources I've created. They're all there for free to help you lead a long, healthy, functional life. My research papers and teaching materials come complete with all scientific references, as well as the ebook, to show that you're getting only the best evidence-based information from me that is sound from a scientific standpoint. So you really should make Meschinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much for watching.